Inhalant Use Disorder, presented by Jania Harris, Shanika King, and Sonia Taylor. Target audience for Inhalant Use Disorder PowerPoint includes advanced practice registered nurses, social workers, and therapists. Upon completion of this presentation, the participant will be able to recognize the signs and symptoms of inhalant use disorder, identify short and long-term effects of inhalant use, know how to obtain treatment for inhalant use disorder. What are the three obvious signs of inhalant use disorder? What age group is inhalant use disorder most commonly seen? What are the three other terms used to describe inhalant use? How are inhalants abused? And what are two treatment options for inhalant use disorder? Will all be covered during this presentation. Learning theory used to develop this presentation was based on Watson's philosophy and theory of transpersonal caring, with the focus being on the seventh character factor. This factor is an important concept for nursing in that it separates caring from curing. It allows the patient to be informed and shifts the responsibility for wellness and health to the patient.
Inhalants are chemicals found in everyday household products that some people use to get high. They breathe in the fumes through their nose or mouth, which is called sniffing, snorting, or huffing. Because the high only lasts a few seconds or minutes, some people use inhalants repeatedly to feel high longer. Some products that people inhale include nail polish remover, felt tip markers, room fragrances, spray paint, paint thinner, hairspray, whipped cream from cans, cleaning products, keyboard cleaner, and lighters. When inhaled, the chemicals go into the lungs, and in seconds, they reach the brain. How do inhalants affect your brain and body? They can cause dizziness, seeing or hearing things that aren't real, liver and kidney damage, or brain damage. Can you become addicted to inhalants? It's not very common, but it can happen. For more information, go to teens.drugabuse.gov.
Diagnostic criteria for inhalant use disorder. A problematic pattern of use of hydrocarbon-based inhalant substance leading to clinically significant impairments or distress, as manifested by at least two of the following occurring within a 12-month period. Diagnostic criteria for inhalant use disorder includes specifiers. It is important to make note if it's in early remission after the criteria for inhalant use disorder were previously met. None of the criteria for inhalant use disorders have been met for at least 3 months, but less than 12 months, with the exception of A4, which is a craving. In sustained remission, after full criteria for inhalant use disorders were previously met, none of the criteria for inhalant use disorder have been met at any point during a 12-month period or longer. Specify if it's in a controlled environment, if the individual is in an environment where access to inhalant substances is restricted. Prevalence. In 2015, nearly 1.8 million children aged 12 or older used inhalants to get high in the past year. It is important to note that female adolescents were more likely than male adolescents to have used inhalants. Inhalant use among adolescents was 2.7% for Blacks, 2.6% for whites and adolescents of two or more races, and 4.6% among American Indians or Alaskan Natives. Inhalant use among ages 12 and older in 2015. Please note the highest use was age range 12 to 13 with 3.4%. Inhalant use among adolescents by gender, and as previously stated, females have a higher percentage of inhalant abuse. Common products used with inhalant use disorder: lighters, nail polish remover, felt tip markers, room fragrance, spray paint, paint thinner, hairspray, whipped cream cans, cleaning products, and keyboard cleaner. Common household items. Inhalants can be abused by sniffing or snorting fumes from a container or a heated pan. Individuals will also spray aerosols directly into nose or mouth and inhale substances from inside a plastic bag. These are a few of the signs of inhalant abuse: chemical odor on breath, paint stains on fingers, slurred speech, frequent nosebleeds, confusion, and irritability. Here's a picture of a guy with what's called Huffer's rash, cracking of perioral skin commonly resulting in a bacterial infection. Effects of inhalant abuse: central nervous system depressant. Toluene toxicity can lead to multiple nervous system dysfunction. Toluene encephalopathy is a medical emergency. Presentation includes hallucinations, nystagmus, seizures, and may even lead to a coma. Cardiovascular system effects: cardiac arrhythmias, hypertension, tachycardia, bradycardia, orthostatic hypotension, and syncope. Management of inhalant abuse. As always, airway, breathing, circulation. Cardiopulmonary monitoring due to risk of sudden death from CNS depression. Screening and assessment of inhalant abuse disorder. Mental health and primary care providers can assess those at high risk for inhalant abuse. Drug abuse screen tests and commonly used urine drug screens will not identify inhalant abuse. It is, however, helpful to rule out other illicit drug use. Confirming inhalant abuse is often done by clinical signs along with history of presenting symptoms, physical exam, complete blood workup to include liver function studies and electrolytes, as well as a chest x-ray. Here are a list of differential diagnoses for inhalant use disorder. Non-pharmacological treatment for inhalant use disorder. Non-pharmacological inhalant addiction treatment strategies do not vary much from those used to treat other addictive behaviors. Individual counseling, such as cognitive behavioral therapy, family therapy, intervention and motivational programs, and aftercare are included in these therapies, which also include support groups. Pharmacological treatment. Currently, there is no evidence-based pharmacological treatment specifically for inhalant abuse. Researchers have suggested substitution therapy with essential oils are effective in craving reduction for inhalant abuse. In the presence of severe delirium, short-term treatment with dopamine receptor antagonist Haldol may be necessary. Avoid benzodiazepines as they may add to the risk of respiratory depression. Evaluation of treatment outcomes, decline in cravings and abuse of inhalants, increased enjoyment in social activities, improved communication and relationship with family and friends, and stable mood. Help is available for inhalant abuse. Here are two numbers to reach out for assistance with inhalant abuse treatment.
Thank you for taking the time to review our technology project. We hope that it has enhanced your knowledge on inhalant use disorder.